Thank you very much. It is my privilege to express my sincere thanks to ICAM for inviting and supporting my participation here. As because I was, from the very beginning, I was involved with the rabies control activities in the country, I have moral obligations to share with my ideas about the MTB, what we conduct in my country. Let us have a look about rabies situation in the country. In our country, we have, you see the area, 147,570 square kilometers. The population is very high, 151.5 million. And in 7 divisions, we have 64 districts. These are the divisions: Rajshahi, Rampur, Dhaka, Chittagong, Borishal, and Khulna. The country is mostly surrounded by India, except the southern part, which is surrounded by Bay of Bengal. And rabies transmission is 95% dog, others by 5%. Dog population 1.2 million, stray dog is more than 83%, and human dog bite cases more than 200,000, and annual animal dog bite is not known. Annual and human rabies cases more than 2,000. Annual animal rabies 25,000 nearly reported by DLS in the country, and rabies burden is more than 85% from the rural community and mostly affected by the children less than 15 years of age. Just have a look why the high prevalence of rabies in the country. The one was ignorance and poverty. Many people don't know where to go, what to do when someone is bitten by a dog. And affected populations are poor, rural, in the same region. And there was no report in the country, and rabies is not a notifiable disease for a long. And lack of political comment at the central level, and no national study for both in human health and animal health. And high dog population density in the country, large number of unvaccinated dog population, public use of ineffective non-tissue vaccine by the local government, and limited use of TCV, who can purchase, only the affluent society can purchase, and ineffective reservoir management. Just what was the situation before? Initially, dog bite management was, in 1956, we initiated rabies control activities by the local government. The management was simply, mostly by traditional healer, Boidya Kobras. The people used to give the spiritual water, milk, and sometimes metallic plate to attach with the affected part, and use of nerve tissue vaccine, limited use of the TCV and RIG. There was unplanned dog killing by direct beating, poisonous bait with strychnine, injection max sulfur to heart, and neck crushing, and limited vaccination of pet dogs. Now, present situation, we started rabies control activities at the government level in 2010. So we initiated and we developed strategy. The strategy goal was reduction of rabies by 90% within 2015, elimination of rabies by 2020. Strategy, there are 6 strategies: advocacy, communication, social motion, SSM, dog bite management, mass dog vaccination, dog population management, pre-exposure problems for high-risk groups, surveillance and research. Before going to MDB, we should know how we started in our country. We initiated rabies control activities in 2010, May. Piloting, we introducing tissue culture vaccine in Dhaka Infectious Disease Hospital in July 2010, and introduction of TCV at national level, May 2011. Within 2 years' time, we scale up to all district hospitals. Training of physician nurses, procurement and distribution of the tissue culture vaccine, ARV, RIG, and function of the dog bite management center at all district hospitals, and stop production of NTB in October 2011. Let's have a look about the center. This is a country map. Each dot area you can see, these are the district headquarters. So we have now 64 dog rabies prevention and control center throughout the country. We have free supply of the vaccine, RIG. This is center. You can have a look. You see the patients are waiting for receiving the vaccines in Dhaka Infectious Disease Hospital. Patients and attendants are coming and they are waiting for the ticketing. This is MDB. We have a MDB action plan draft. The goal was completion of 3 rounds of MDB throughout the country by the year 2016 for achieving elimination of rabies by 2020. Objective, creation of herd immunity among the dog population, thereby breakdown of chain of transmission from animal to animal or from animal to human. We set some principle, vaccinating covers more than 70%, 3 rounds of completion of MDB, and high quality vaccine use, international standard protocol to follow, multi-sectoral and integrated one health approach to implement the program. This slide, most of you know, just I try to show the two-way transmission and one-way transmission among the canine and dog population. Thereby, it is transmitted to dog, transmitting to pet animals and domestic animals and human beings. It is circulating in the society. This is a slide, most of you know the NB, how confirm herd immunity. I'm not repeating. At the beginning of the MDB, we had some planned activities. We call all the key stakeholders, agencies, Minister of Health, Livestock Department, NGOs working home and abroad, and local government as well. And we sat together and we made budget, and we made series of conference meeting, workshops, and advocacy meeting we conducted. We call all mayors, civil surgeon, district livestock officer, NGOs work on rabies control in Dhaka. We brought them, we asked them to come, and we just gave a briefing before conducting MDB. And selection of the MDB team, veterinary officer, vaccinator, animal control staff, border dog counter, and procurement logistics, equipments and vaccines, training of the veterinary officers, production and communication materials like poster, banner, leaflet, costumes, etc. And preparation of the MDB schedule and communication, distribution of logistics and equipments to the vaccination site, and selection of the supervisor for MDB so that they can visit and monitor the MDB activities at the field level, MDB field operation. This is the picture. Just we try to we said with the secretary, Minister of Local Government, and Chief Health Officer, our previous director, Professor Banerjee. I think this is Dr. Rahul Segal from India, and this is the WESPA staff, and over and no, we set series of meeting and workshops. Again, this is, all of you know how we conducted MDB. Advanced plan is made at the on-site of vaccination. We arranged a preparatory meeting with the key stakeholder at the district level where we conducted, particularly mayors, civil surgeon, district livestock officers, local coordinators, media people, and representatives of the district commissioners. And we set communications materials developed, key messages prepared and sent to the people, and communication logistics arrange, and dog catching, handling for vaccination ensure, vaccine storage and transportation ensured by the local government, injection arrival, marking dogs, record keeping, and post-vaccination dog counting, data analysis. Those are the steps we followed. At the central level, from the Ministry of Health, headed by the Director of Disease Control and his team, and Minister of Fisheries and Livestock, Director and Animal Health and his team, and from the local government, Secretary, Joint Secretary and his team, we sat together and we centrally coordinated for the MDB activities throughout the country. At the local level, if MDB is conducted at the division level, at the city corporation level, same as the Minister of Health, Minister of Fisheries, Livestock, Minister of Local Government, we all coordinated at the field level. At the Upaja level also the same thing. And this is the MDT member. Nowadays we are getting service from WSP previous World Protection Animal. Their support is 8 MDB consultant for MDB supervision in the field level. Vaccinator, dog catcher, porter, these are the team members. Logistic, I don't want to spend my time to just mention all the things we use. This is the same thing. Our technical support from CDC, we utilize our human resources, logistic capacity building, and operational cost by the Ministry of Health, CDC. While animal production, they help us by providing logistics, vaccine, technical support, OA, ARV for animal use. They supported us. We conducted MDB at the field level within a week. Just time frame was like that. In day 1, advocacy meeting, preparatory activities conducted. In day 2, orientation of animal control staff, micro-planning. In day 3 to 6, within a very short time, we conducted MDB and mop-up campaign. We followed a snowball approach. Initially, we started piloting rabies MDB in Cox's Bazar. We trained some staffs, with the cleaning staffs as dog catcher, with the technical help and direct supervision by probably a previous SPU or WSPU. After that, we again conducted one more piloting in Sharkira. We use few staffs from Cox's Bazar as animal control staff. Then we utilize those staff to some other MDB area. In such a way, we gradually develop our capacity. Before piloting MDB, we follow this strategy: MDB planning, strategy development, budgeting, procurement, and logistics and scheduling, where to conduct MDB. Initially, as I told before, we conducted MDB piloting first in Cox's Bazar in 2011, Sharkira in 2012, and 2 more Upazila sub-district level at Sharkira Shodor, Dhamrai, and 1 rural setting and Nalta Union, Kaliganj in 2012. Lead agency was HED and collaboration LGD local government division, livestock department, WHO, previous WSPA, our local NGO. Team was veteran officer. These are the staffs, and covers in Cox's Bazar was 71%, and Sharkira also the same. This is the Cox's Bazar, a tourist district. This is the airport.
You have 5 minutes left. I just wanted to know.
From this area, we started MDB. This is some advocacy mapping, this is communication campaign, and MDB in field operation. And within 2 years' time, we scale up MDB throughout the country, and we have some which I will show you. These are the activities what we did. This is the dog catcher with doctors. You can see Dr. Dana, who is WSO SPA staff, Dr. working Bangladesh. This is the activity. Now we have more than 1,000 expert dog catchers. Previously they are just cleaning staff. We trained them and cleaner staff into the expert dog catcher now. In such a way, we, out of 64 districts in the country, we conducted MDB in 63 district municipalities. This is a dot area, the MDB cover area throughout the country. In 2011, we conducted first round of MDB in Cox's Bazar. In 2012, first round in Sharkira and 4 division, Rajshahi, Rampur, Rajshahi, Silet, Dhaka division, we conducted first round. And in 2012, second round in Cox's Bazar. And in 2013, Chittagong, Khulna, we conducted first round, and Sharkira second round. In 2014, these are the districts, and we cover first round of MDB. In total, we conducted MDB in 64 districts in this campaign, and coverage is nearly 84%. What is our achievement? We first round MDB 60 districts we have finished. Third round MDB conducted in Sharkira and Cox's Bazar municipality, and MU signed with mayors of the 9 city corporation and 63 district municipalities. And MDB coverage was more than 80%, nearly 80%, 85%. And task case is first round MDB in Dhaka City Corporation North, South, Gazipur, and we are planning to do MDB in Gaiband also, one more district. Second round and third round MDB 63 district municipalities, including Dhamrai, Nalta Union, and Kaliganj. And first, second, third round in 500 Upazila, because we just finished MDB in district municipalities. Still we have sub-center like sub-Upazila, like sub-district like areas which is called Upajal in the country. We have a plan MDB first round in Dhaka City Corporation, South and North Gazipur City Corporation, and second round in 6 cities in 2014 to 15. But because nowadays, due to political instability, we have some stagnation of the MDB campaign. But we are prepared to launch the program soon. And first round in 97 Upajalas of Dhaka division. And MDB plan for 2015 to 16, the second and third round in Dhaka City, this and second and third round in 6 cities again, and second and third round in 97 Upajalas. Just I want to share the funding status of the MDB. We got a 40 million Bangladeshi taka from CDC Ministry of Health. WSPA previously they provided $20,000 for logistics, $20,000 for local veterinary consultant, and 108,500 doses of animal vaccine. We have 200,000 doses of animal vaccine provided by UAE. And WFAO and yet to decide. And WHO provided technical support and funding for initial pilot project in Cox's Bazar. And local government yet to decide, but previously they had a fund for dog killing and mass, and NTB use. But we are try to mobilize that fund to MDB and dog population medicine in near future. And DLS in our country, the animal health department, they are still behind. We try to mobilize and try to motivate them so that they're also working for next MDB to participate for DPM also. If you look at the results, rabies mortality in the country, before 2010, it is a one center infectious disease hospital in Dhaka, more than 160. And in 2010, we had a survey, it was 2,147 mortality per year. And it was gradually declining. In 2012, it was like in one center. We counted one more survey in 2012, it was 1,445 only. What? This is not okay. In 2013, jumped to July, only 46. Okay,
Dr. Marma, you are running out of time.
So our strength, we develop capacity in terms of human resource, dog catchers, this is the person, and multi-sectoral collaboration, technical and financial support from international agencies, and ensure community participation. We have some challenges. Timely allocation of fund, that's why we cannot start the program, and integrated human resources in the field level for monitoring supervision at the center level as well. Demanding of 4 separate programs, as because until now rabies is a program run by the highly patented emerging disease control program. We are advising to create a separate program so that we can work individually. And strengthening of the SSM activities in the country, community participation, completion 3 rounds of MDB throughout the country, and political instability, control of wild cat and rabies, these are the challenges. However, we have way forward implementation of all the action plan and strategy related to rabies control activities in the country. And continuing advocacy for multi-sector collaboration, cooperation, coordination, integration. Implementation of MDB throughout the country with One Health concepts, DPM through ABC. Let's create a rabies-free world. Thank you very much for your special hearing.
Thank you very much. Thank you. Okay, maybe we can take one question and then the rest you can save it for over lunch, because I think everybody is probably ready for lunch now. One question?
Hi, I'm Holman from Singapore. I would like to really commend your country for being able to achieve a vision of being rabies-free by 2021. And I noticed that you also work with WAP, and I think we also heard from WAP about they are working with some ASEAN countries on the ASEAN Rabies Elimination strategy by 2020. But I would think that perhaps you could share your experience with the ASEAN countries who are actually aiming towards being rabies-free by 2020. I think what you have done in your country and could possibly be replicated in some of the ASEAN countries. Thank you.
Thank you very much. Actually, we have we can say that it is a really great achievement. Within very short time, we set a vision, and we develop our mission and strategy. In such a way, we had carried out all those activities. Yes, it is replicable, and I think if everything goes on smoothly with the support of our government, we are trying to mobilize our key other stakeholders as well. Ministry of Health, Ministry of Livestock Department, and Ministry of Local Government. We are working together. At the same time, local NGOs and international NGOs are coming forward. We expecting, as of until now, Human Society International, they are working for the population management. They are working with one NGO in our country. We have a plan to initiate DPM as well soon. But before that, we need to establish MTB throughout the country. And hopefully we will be able to do this job quickly and possible. So far, I think.
Thank you very much, Dr. Marma. Can we have a round of applause for all of our speakers?